We'll be looking at very common illness. It's a mental illness. It is described as one of the mental illness in the DSM-4, and it is the PTSD, called the post-traumatic stress disorder. It is a stress-related mental illness, and let's see how it comes to an individual, how it happens. So first let's see the definition. The definition of PTSD are defined as an individual who have been exposed to a traumatic event in which one person experienced with or witnessed or was confronted with actual or threatened death or serious injury or the threat to the physical integrity of self or other. So this is the definition given in the DSM-4. And then, so what are the traumatic events that can lead to PTSD is like war, natural disasters, like car or plane crashes, accidents, terrorist attacks, childhood neglect. It is one of our main topic, and kidnapping, assault, rape, physical abuse, sudden death of a loved one, sexual abuse, like that. Lot of even mental abuses, tortures can also be a lot of stresses which can lead a human to a distressing position. So when a human is continuously affected such like this, he can get this PTSD. So the risk factors for the PTSD include: women are at greater risk than males. Previous traumatic experiences, especially early in life. An individual's early in life, like when in his childhood or in his teenagers, when an individual is exposed to very traumatic events, it would lead him to PTSD later in his life. Family history of PTSD or depression. If his family history, if any of his blood relatives have been affected by depression or this PTSD, it can be a risk factor for the individual also. History of physical or sexual abuse, history of substance abuse. So physical or sexual abuse can also lead to PTSD, and also substance abuse like drinking alcohol, taking drugs, like that. And if there is an history of depression, anxiety, or any other mental illness, so if at all the individual has any other type of mental illness, he would later can be affected with this PTSD. And a high level of stress in everyday life, and lack of support after the trauma. And this is a very important thing. If the individual doesn't have a good support, then it will lead to PTSD after the trauma, after witnessing a traumatic event. If he doesn't have any support or care or love, he would be put into he would get this illness. And also lack of coping skills. If he doesn't have the coping skills to cope up with the trauma, he would get into this. So let's see what are the signs and symptoms of a PTSD. So if an individual gets this illness, there will be obvious signs and symptoms in his behavior. So what are these symptoms are? First symptom of PTSD is re-experiencing the traumatic event. After many years, he may re-experience the same traumatic event as if it is happening at present. That is intrusive and upsetting memories of the event. He will be having those memories still on his brain. It will be never, he can't forget that. And then flashbacks are nothing but whatever happened during those traumatic event will come again and again before his eyes. He will be feeling the same emotional, and the emotion which he felt during the trauma will be felt even after many years. So that are flashbacks. And he will have nightmares are nothing but bad dreams. So he'll be having dreams even in his night sleep. He'll be having dreams about that. Feelings of intense distress when reminded of the trauma. So when the person, even when he doesn't have the memory of it, when he sees something which is related to that event, or when he sees the place after many years where the traumatic event happened, he would become very intense distressed, because he will be when reminded of the traumatic event, and there will be intense physical reactions after when he remembers the traumatic event, like pounding heart, the heartbeat would raise. There will be his breath would he would he can't breathe properly because of this pounding heart. It is because of fear, and there will be nausea, muscle tension, and sweating. All this becomes because of fear. There will be a fear anxiety in him because the same trauma, he'll be re-experiencing it. So that is the worst thing about this illness. So the symptoms of PTSD, number two is avoidance and numbing. So this is another symptom. So avoiding activities, places, thoughts, or feelings that remind the trauma. So we will be completely avoiding, the individual will be completely avoiding the play activities, places, thoughts, feelings that reminds the trauma. It means that any similar event or activities, or any similar places or thoughts or feelings which are related to the traumatic event, he will be avoiding it. So inability to remember important aspects of the trauma. So he cannot remember fully what happened during those traumatic events. Loss of interest in activities and life in general. So the individual will not feel interest in the present life life activities, feeling detached from others and emotionally numb. So the individual will feel detached from others, and emotionally he will also be very numb. He can't uh, he can't feel emotions properly. Sense of limited future. You don't expect to live a normal lifespan, get married, have a career. So, so the individual will feel that he won't have a normal life. Uh, so that is one of symptoms. Symptoms of third symptom is increased anxiety and emotional arousal, difficulty falling or staying asleep. This is very common. Uh, any trauma, when you experience any kind of trauma, you can't fall asleep. So even if you fall asleep, you can't stay asleep for a long time, and there will be irritability and outburst of anger, because of the trauma he experienced, and difficulty concentrating. He can't concentrate properly in any activity. Again and again, the thoughts about the distressing thoughts about the event will be reminded. There will be hyper vigilance. He would be always on vigilant mode, because he will be feeling the life he's living in a dangerous world. He would get a feeling of living in a his life is a dangerous place. The world is a dangerous place to live. Feeling jumpy and easily startled. Other common symptoms of PTSD are anger, irritability, guilt, shame, or self blame, substance abuse, feelings of mistrust, depression and hopelessness, suicidal thoughts and feelings, feeling alienated and alone, and physical aches and pain. These are the common symptoms which are associated with PTSD. Uh, so in children and also in adolescents, PTSD can be experienced, and the symptoms for them must be a fear of being separated from parent, losing previously acquired skills such as toilet training, sleep problems and nightmares without recognizable content, compulsive play in which themes or aspects of the trauma are repeated, new phobias and anxieties that seem unrelated to the trauma, such as fear of monsters, acting out the trauma through play, stories, or drawings, uh, aches and pains with no apparent cause, and there will be irritability and aggression. Uh, So mnemonic for screening patients of PTSD are, so dreams, that is the demonic word which doctors use for treating, I mean screening a patient to say that he is affected by PTSD is first detachment, and the next very important thing is re-experiencing the same traumatic events, uh, and the event had, when re-experiencing those events, the event had emotional effect. So when you see re-experiencing those events, you'll be having that emotional effects, and there will be avoidance of such places or such thoughts, such things which are related to the traumatic event, and month in duration. So the doctor will also be screening that how many months or years have passed after the traumatic event and still he is experiencing it, and sympathetic hyperactivity or hypervigilance. So these are the screening tests that are used for a PTSD patient. So the DSM-4 diagnostic criteria is the person has been exposed to a traumatic event in which both of the following were present. The person experienced, witnessed, or was confronted with an event or events that involve actual or threatened death or serious injury. The person's response involved intense fear, helplessness, or horror. So, so this is what a traumatic event in the is defined, how a traumatic event is defined. These 2 points are very important. And so the second thing which the DSM-4 tells us that traumatic event is persistently re-experienced in one of the more following ways: recollections of the event including images, thoughts, or perceptions; dreams of the event, acting or feeling as the traumatic events were recurring, including sense of reliving the experience; illusions, hallucinations, and dissociative flashback episodes. The fourth thing is intense psychological distress at exposure to internal or external cues that symbolize or resemble an aspect of the traumatic event. Physiological reactivity on exposure to internal or external cues that symbolize or resemble an aspect of the traumatic event. There will be physiological and psychological distress. So the third thing is persistent avoidance of stimuli associated with trauma and numbing of general responsiveness. Uh, Efforts to avoid thoughts, feelings, or conversation associated with the trauma. Efforts to avoid activities, places, or people that arouse recollections of the trauma. Uh, inability to recall an important aspect of the trauma. Markedly diminished interest or participation in significant activities. Feeling of detachment. Restricted range of affect. Unable, that is example, unable to have love feelings. Sense of foreshortened future, that is does not expect to have a career, marriage, children, or a normal lifespan. And the fourth thing is persistent symptoms of increased arousal, as indicated like difficulty falling or staying asleep, irritability or outbursts of anger, difficulty concentrating, hypervigilance, exaggerated startle response. So the duration of the disturbance, that is the symptoms described in criteria B, C, and D, is if it is present more than 1 month, and impairment in social, occupational, and other important areas of functioning. So let's see about the treatment in the next video. So in this video I just want to give you an enlightenment on this PTSD illness. So I'll be meeting you in the next video. Thank you all.